hospital admissions have spiked worldwide due to the pandemic, and Turkey's no different. But not all the patients at this Istanbul hospital are seeking treatment for COVID-19, and doctors are under extra pressure to keep them safe from the contagious disease.
For non-COVID patients, we decreased the number of checkups. We used audio or remote visual communication with patients. We are trying to make it possible for people to get treatment with the minimum amount of hospital visits. For our staff, we make sure no single staff member treats both COVID and non-COVID patients, and we track symptoms very closely. So far, we haven't had a single case of COVID in our hospitalized patients during or after their treatment.
Despite reducing the number of non-COVID patients attending the hospital, doctors are still performing essential surgeries. But the pandemic is making many reluctant to go under the knife.
We are continuing our surgical operations without any complications, but there is a decrease in the number of patients because they are afraid of COVID, and especially for cardiovascular situations, delaying is a problem.
Dr. Erkanlı says putting off surgery may in fact come with greater risk. One patient, Saim, delayed seeking treatment for cirrhosis of the liver because he was nervous about the virus.
I could no longer breathe. I would get tired just by walking a couple of steps. I was sleeping and waking up in fear. I've been dealing with my liver problems for a year, and I had doubts about going to the hospital because of getting infected. But I had no choice but to get hospitalized and undergo the surgery.
When he finally did, the doctors discovered he urgently needed a liver transplant, and that wasn't all.
After more tests, we realized he also needed to have a bypass surgery. Both surgeries were carried out simultaneously. In his case, for example, he really didn't have much time to wait.
Before being admitted into the hospital, Saim had to take a COVID-19 test. After a negative result, he was isolated to prevent from an infection until his surgery here, in this operating room. Luckily, his son was a suitable donor, and both surgeries were a success. Doctors insist comprehensive safety measures against COVID-19 are in place and urge those needing surgical care not to delay. Furkan Yağmur, TRT World, Istanbul.